The reason I originally came in was my son, he's 6 years old, and he has been struggling with having accidents, daytime accidents and nighttime, for a few years now. We have talked to his pediatrician about it, we have talked to different doctors, I've gotten a few different opinions, and everyone I asked, it started when he was 3. I was just told he'll grow out of it. And then he got older, he didn't grow out of it. We went through kindergarten last year with it being a problem, a constant problem, multiple times a week often, where he was having accidents in school. And we either were always told, maybe he's constipated, maybe he just maybe we need to figure out why he's constipated, or he's just going to grow out of it. And nobody really did anything to diagnose the issue. There were guesses about what was going on. The only actual treatment that was ever prescribed was for him to do a weekend of kind of multiple doses a day of Miralax, followed by staying on Miralax for 6 months. After a few years of that, it wasn't getting better, so we decided to try and see if there was maybe a chiropractic answer to it. So when I came in and met with Dr. Barcombe, when I told him what the issue was and what was going on, right away he had an idea of what the problem was. And it was the first time that I had met with anybody who didn't really just look at me kind of clueless and think maybe he just needs to grow out of it. So then right away after he examined him, we went in and Dr. Barcombe did an x-ray, and right there on the screen was exactly the issue that he thought was there. And it was such a relief to see that there was to have a solution to what the problem was, to understand what was causing this problem all this time.
Upon examination, there was an area of the spine that was very swollen, very inflamed. Took an x-ray, and in the bottom part of the spine, in the sacral area, there was a dislocated segment there. It stuck out like the proverbial sore thumb. The mother immediately broke into tears when I pointed it out to her. We treated this child, reduced that dislocated segment 3 times. I saw the patient yesterday, and he hadn't had an accident for almost a month now, but he said something that was very telling. We were having a little conversation, the mother, the 6-year-old child, the child was 6 years old. And he said, "No, I don't have any problems now, I can feel it." And that's exactly what he couldn't do before, is he couldn't feel when he had to go to the bathroom. And now he could. Because the area of the spine that we were working with, the S1 nerve root, is one of the nerve structures that helps that child feel when he goes to the bathroom.
It was definitely a very emotional experience because when you're looking for answers as a mother and you're going to the people that are supposed to have the answers and everyone just has nothing for you, it feels hopeless. And when suddenly, I didn't know yet if we were going to be able to fix it, but I knew it was the first time that there was at least a light at the end of the tunnel, and that was a very emotional experience, knowing that maybe we had turned a corner. I think that the biggest takeaway from this experience for me is that really, as parents, we need to look for other solutions. And sometimes there's people that are experts that we go to for those answers, but when we don't find the answers that we want, there are other options. I think that a lot of people don't think about chiropractic as their first line, their first resource. As parents, we go to a pediatrician, and that's where we get all the answers for our children. And for me, in this situation, I didn't get those answers there. I now know that there are other options, and this is definitely something that I should consider when I'm having an issue with my child. That I wouldn't have thought this was related to chiropractic, but it completely makes sense now that I know it does, now that I know how it works.